Well, May is Stroke Awareness Month. Every second, a stroke kills 32,000 brain cells. The longer you wait for treatment, the more damage will be done. That's why knowing stroke signs and stroke prevention are so critical. Joining us now is Karen Old, stroke director at St. Luke's Marion Block Neuroscience Institute. As I understand, Karen, 80% of strokes are preventable by having healthy lifestyle. So what are some of those key habits and routines that people should know about?
Well, I think most importantly is to be able to understand what the risk factors for stroke are and also what your personal risk factors for stroke are. So healthy lifestyle is important with diet and exercise, and then knowing how you're doing in regards to how does your blood pressure run, how does your cholesterol look, do you have trouble with your blood sugar? Do you have pre-diabetes or diabetes? So following a healthy diet and exercising regularly can really decrease those risk factors, and having a relationship with a provider that can help keep an eye on those types of things.
And why are regular visits to your primary care physician important to address these healthy habits and other risk factors?
Well, I think most importantly is to be able to understand what the risk factors for stroke are and also what your personal risk factors for stroke are. How does your blood pressure run? How does your cholesterol look? Do you have trouble with your blood sugar? Do you have pre-diabetes or diabetes? You need to make sure you're checking those things and having a relationship with a provider that can help keep an eye on those types of things.
Now, the key phrase for stroke warning signs is be fast. Can you explain what that stands for?
Sure. Be FAST is an acronym, and it speaks to what are some of the warning signs of stroke. So the B stands for balance. And remember that strokes occur suddenly, often without warning. So a sudden onset of loss of balance or a feeling of spinning, such as vertigo, is one stroke sign. E is for eyes, and that means a sudden onset of double vision or a sudden onset of loss of vision, usually in one or both eyes. FAST is the more traditional acronym that we taught solely for years, and the F stands for face, so a facial droop on one side. The A is for arms, so an arm weakness or a droop of the arm trying to hold it up on one side. S is for speech, and that can be either an onset of slurred speech that happens suddenly or sometimes the inability to get the right words out. And then T is for time, and that helps to highlight how important time is of the essence. We don't want to wait and have a stroke go untreated.
And why is it so important to seek treatment immediately?
So our ability to reverse stroke-type symptoms, if it's from an ischemic stroke or an area that doesn't get blood flow, has a pretty small window of opportunity. We can give medications that are known as clot busters within the first 3 hours, maybe 4.5 hours of time last known well, or if the symptom onset is known. Having a neurointerventionalist go inside the system in the vessels and retrieve clots that may be blocking major vessels has a little bit longer of a time frame. But as we mentioned at the beginning, 32,000 brain cells die every second that the brain is blocked of oxygenated blood. So the quicker that we can get flow restored, the more likely we are to have reversal of stroke symptoms and less loss of movement or ability.
Now, we are starting to see an increase in stroke prevalence in younger populations. Do you know what's driving that trend?
I think there's a lot of things driving that trend. First of all, I think we're more aware that strokes can occur in younger people, ages 18 to 49, and it's not insignificant. Most of the time, we will find some traditional risk factors such as high cholesterol, diabetes, high blood pressure. There's also a higher prevalence of drug use in young people. Women that are younger may have a higher risk of stroke from situations like pregnancy and estrogen-containing oral contraceptives.
Really important information. Thank you so much for joining us. To learn more about strokes and treatment options, visit stlukeskc.org/stroke.